Okay, imagine this. A condition where the very vessels carrying blood to your arms and legs, well, they start to kind of turn on you.
Yeah, it's like they're strangling the circulation from the inside.
Yeah.
It's rare, thankfully, but really serious.
Exactly. And today we're going deep on Buerger's disease. You might also hear it called Thromboangiitis Obliterans. Bit of a mouthful, that one.
Mm-hmm.
So let's break it down. It's basically this inflammatory thing, right? Affecting the small and medium blood vessels.
Mostly in the limbs. Arms, legs, fingers, toes.
And these vessels get inflamed, they can form clots,
Stubborn ones, yeah.
they block things up.
Which leads to blockages and ultimately damage to the tissues.
That's right. Real trouble for the tissues they're supposed to be feeding. And it's chronic, it sticks around, really hits that peripheral circulation hard.
It's pretty striking how this, localized problem in the limbs can cause such big issues.
Definitely. We're talking arterial ischemia, that's restricted blood flow, super painful, especially in fingers and toes.
And then there's superficial thrombophlebitis. That's when veins near the skin get inflamed, tender.
Okay.
And worst case scenario, it can progress to gangrene, actual tissue death, or ulceration.
Wow. And the cause. It's not totally pinned down, is it?
Not the exact mechanism, no, but the link is incredibly strong. Overwhelmingly, it points to heavy tobacco use. That seems to be the main trigger.
Right, tobacco.
Plus, likely a sort of misdirected immune response in people who might be genetically susceptible.
Okay, so our mission for this deep dive,
Yeah.
nail down the essentials of Buerger's. What is it? Who gets it? What are the warning signs? And, what can actually be done?
So it's good.
Let's start with who's most at risk. Who tends to get Buerger's?
Right. So if we look at the risk factors, one stands way out.
Let me guess. Tobacco.
You got it.
Yeah.
Tobacco use, especially smoking, it's almost like a requirement in most cases. It's the fuel for this inflammation.
Okay, number one. What else?
Well, there's a strong tendency for it to affect younger adults, usually men. I think like 20s and 30s mostly.
So young men who smoke are the prime group.
That's the classic picture, yeah. But there's also a genetic element. It seems to be more common in people with backgrounds from Asia and the Middle East.
Interesting.
And another potential link is glucose intolerance. Some association there, too.
And geographically, is it common everywhere?
No, not really. Our sources say it's relatively rare in the UK,
Okay.
and it seems to be decreasing in many developed countries,
Hmm.
probably because smoking rates have gone down.
Makes sense.
But in places where tobacco use is still high, you see it more often.
And you said mostly men, but is that changing?
It is,
Yeah.
unfortunately.
Yeah.
While it's historically been, predominantly men, we are seeing more women diagnosed now.
Which probably reflects changing smoking habits in women.
Sadly, yes. The typical age is often around, say, 19 to 55, but the average hits right around 38 years old.
Okay, so that gives us a good picture of who's affected. Now, how does it actually show up? What are the signs, the symptoms someone might experience?
Yeah. What should you look out for?
Well, the presentation can vary, but some things are quite classic. Raynaud's phenomenon is a big one.
Ah, yes, the color changes.
Exactly. Fingers and toes going white, then blue, then red, usually triggered by cold or stress. Then there's ischemia in the extremities, basically not enough blood flow.
Right.
And that can cause these really painful sores, ischemic ulcers, especially on fingers and toes.
And in severe cases, actual ulceration or even gangrene.
Yeah, gangrene of the limbs.
Yeah.
And another key thing is intermittent claudication.
Can you explain that one?
Sure, it's like a cramp, usually in the legs or maybe arms, that comes on when you're active, like walking.
Because the muscles aren't getting enough oxygen.
Right. And then it gets better when you stop and rest.
Got it. What else might people notice?
Well, just general pain, tenderness in the affected limbs, sometimes numbness or tingling.
Discoloration too, right? The limbs might look different.
Yeah, maybe pale or bluish. And you mentioned superficial thrombophlebitis, those tender cords under the skin from inflamed veins.
And because the blood flow is bad, wounds just don't heal well.
Makes sense. So slow healing is another clue?
And if a doctor examines you, they might find the pulses in your feet or wrists are weak or even absent.
Okay.
Plus that sensitivity to cold we mentioned with Raynaud's. Hands and feet just feeling cold all the time.
And you mentioned rarer symptoms too, like affecting the eyes.
Yeah, occasionally there's going to be ocular issues, problems with vision, but that's less common.
Okay, so quite a range of symptoms there. How do doctors figure out if it is Buerger's and not something else that looks similar?
That's a really important question. The diagnosis isn't just one test. It's more about putting pieces together.
Like criteria.
Exactly. There are clinical criteria they look for. Usually the patient is younger, say under 50.
Okay.
A definite history of tobacco use, that's key.
Right.
Evidence of artery blockages, like those weak pulses. Often involvement of the upper limbs, arms, as well as legs, though not always.
And crucially,
Ruling out other common causes of artery disease, like high cholesterol, high blood pressure, the usual suspects for atherosclerosis.
yeah.
Buerger's often happens without those typical risk factors.
Gotcha. And I assume there are blood tests and stuff?
Oh, absolutely. Lab tests are vital for ruling out other conditions.
What kind of tests?
Things like a full blood count, checking liver and kidney function, just general health markers.
Standard stuff.
Yeah. Fasting glucose to rule out diabetes, which can cause similar vascular issues.
Makes sense.
Then inflammatory markers like ESR and CRP to see if there's general inflammation.
Mm-hmm.
Autoantibody tests. These are really important to check for autoimmune diseases like lupus or scleroderma that can attack blood vessels.
Okay, so ruling out autoimmune causes.
Exactly.
Mm.
And sometimes screening for hypercoagulability, basically, does the blood clot too easily.
Right, so lots of lab work to exclude other possibilities. What about actually looking at the blood vessels? Imaging.
Definitely. Imaging is key. Angiography is a big one.
How does that work?
They inject a special dye into your bloodstream and take x-rays. It lets doctors actually see the arteries and veins.
And look for blockages.
Yeah, and characteristic patterns seen in Buerger's. Sometimes they talk about a corkscrew or tree root appearance of the smaller vessels trying to get around the blockages.
Oh, okay. Any other imaging?
Doppler ultrasound is used a lot too. It's non-invasive, uses sound waves to check blood flow in the limbs. It can show where flow is reduced or absent.
Simpler than angiography, I guess.
Yeah, and sometimes an echocardiogram, an ultrasound of the heart, might be needed.
Why the heart?
Just to make sure the clots aren't actually forming in the heart and traveling down to the limbs, which can mimic Buerger's symptoms, ruling out an embolic source.
Got it. And biopsies? Do they take tissue samples?
Generally, no. Skin biopsies aren't usually done because there's a real concern about poor healing. The tissue already has bad blood supply. You don't want to cause another wound.
Right, makes sense. So the diagnosis relies heavily on the clinical picture, the risk factors like smoking and ruling out a whole bunch of other conditions.
Precisely. The differential diagnosis is huge. Early on, you've got to consider other causes of Raynaud's like SLE or scleroderma we mentioned. But Buerger's often hits harder and faster, gangrene or ulcers showing up earlier in younger people compared to typical peripheral artery disease.
So the aggressiveness is a clue.
It can be. So you really need to exclude those autoimmune diseases, clotting disorders, diabetes thoroughly.
Okay. So we've covered what it is, who gets it, the signs, and how it's diagnosed. Now the big one, how do you manage Buerger's disease?
Right. And the answer here is incredibly clear, though maybe not easy.
Let me guess again. Stop smoking.
Absolutely. Complete, total, lifelong cessation of all tobacco use. Smoking, chewing, vaping with nicotine, all of it. It's the only thing known to actually stop the disease from getting worse.
Wow. So that's non-negotiable.
Non-negotiable. If someone keeps using tobacco, honestly, nothing else is likely to work long-term. The disease will likely progress.
That's a stark message. So beyond quitting tobacco, what else can help? Supportive stuff.
Yeah, there are important supportive measures. Things like gentle massage, keeping the hands and feet warm that helps blood flow.
So avoiding cold is critical.
Definitely. Avoiding cold exposure. Also, try not to sit or stand still for really long periods.
Keep moving a bit.
Right. And protecting the feet and hands. Don't walk barefoot. Avoid tight clothes or shoes that could restrict circulation.
Makes sense. What about wounds?
Any cuts or ulcers need really careful, aggressive wound care. Prevent infection. Try to help them heal despite the poor blood flow.
Okay. And activity, you mentioned claudication earlier.
Yeah, for claudication, gentle walking exercise is often encouraged. It can help build up smaller collateral blood vessels over time.
Like natural bypasses.
Sort of, yeah. But if someone has really critical ischemia, like constant pain even at rest, then bed rest might actually be needed temporarily.
Okay, so tailor the activity level. What about drugs? Are there meds that help?
There are a few, but it's not like treating standard heart disease. Intravenous iloprost, that's a prostaglandin drug, has shown some benefit.
How does it help?
It can improve symptoms, maybe reduce amputation risk compared to placebo, or even IV aspirin, but it has to be given intravenously. The oral form didn't really pan out.
Okay, IV iloprost. Anything else?
Bosentan is another drug being looked at, but we need more research there.
Right. And what about common drugs people might think would work? like blood thinners or things for blood pressure.
Yeah, it's important to know what doesn't work generally. Calcium channel blockers, steroids, standard anticoagulants, or antiplatelet drugs, they haven't really shown much benefit specifically for Buerger's.
Okay, good to know.
And a really crucial point, nicotine replacement therapy, like patches or gum, not recommended.
Because it's still nicotine.
Exactly. Nicotine itself constricts blood vessels, so it can make things worse, even without the other toxins in smoke.
Wow, okay, so no NRT, and avoid other drugs that constrict vessels too.
Absolutely. Things like some decongestants, for example. Got to be careful.
Right. What about surgery? Are there surgical options?
There are a few approaches, but again, it's tricky. Surgical sympathectomy is one.
What's that?
It's a procedure to cut some of the nerves that signal blood vessels to tighten up. The idea is to relax the vessels and improve flow.
Does it work?
Some studies suggest it might be better than IV iloprost, but the evidence quality isn't super high. There's also a more targeted version, periarterial sympathectomy, sometimes used for severe finger or toe ischemia.
Okay. What about bypass surgery, like they do for blocked leg arteries?
Generally, bypass doesn't work well in Buerger's. The blockages are often in smaller, more widespread vessels, making bypass difficult or ineffective.
Okay. Not a great option then.
But angioplasty using balloons to open arteries is showing some promise, especially if they target the arteries lower down in the leg and foot, the tibial and pedal arteries. It might help reduce amputations in some cases.
So minimally invasive options might be evolving.
Yeah, there's also a special stent puncture technique for more complex cases. And interestingly, spinal cord stimulation.
Like for pain management.
Exactly. But somehow, it's also been found to reduce amputation rates in Buerger's patients. We don't fully understand why yet.
That's unexpected.
It is. But of course, if gangrene sets in and can't be reversed.
Amputation might be the only option.
Sadly, yes.
Yeah.
Distal amputation, fingers, toes, maybe part of the foot might be necessary to stop infection spreading. And the risk of needing more amputations is much, much higher if the person keeps smoking.
A vicious cycle. Are there any newer therapies on the horizon?
There's definitely research happening. Things like stem cell therapy.
Using the patient's own cells.
Yeah, or using growth factors like GCSF to mobilize the patient's own mononuclear cells. The idea is to promote healing and maybe grow new vessels. Early results seem promising for reducing amputations in severe cases.
That sounds hopeful.
In therapeutic angiogenesis, trying to stimulate new blood vessel growth directly.
Yeah.
That's being explored too, but the evidence isn't quite strong enough for routine use yet.
Okay, so research is ongoing. What's the overall outlook, the prognosis for someone diagnosed with Buerger's?
It really hinges on that one factor, smoking.
Stop smoking, better outlook, keep smoking, progressive disease.
That's the long and short of it. If smoking continues, the disease typically progresses. If it stops completely, the progression usually halts.
Are there different patterns to how the disease behaves?
Yeah, doctors describe a few forms. The most common is relapsing remitting periods where it flares up, then periods where it settles down.
Okay.
There's also secondary progressive, primary progressive, and sometimes a more benign form, but relapsing remitting is typical.
And you mentioned amputations. When do those usually happen, if they do?
Unfortunately, most amputations tend to occur relatively early, often within about 6 years of diagnosis, usually linked to disease relapses, often fueled by continued smoking.
6 years. That's quite fast.
It can be.
Yeah.
And having smoked for a long time, say over 20 years, seems to increase the risk of needing a major amputation.
But there's hope if you catch it early and stop smoking.
Absolutely. Early diagnosis, getting the right supportive care, and crucially, that immediate and total stop to all tobacco that dramatically improves the outlook.
Okay. Finally, what are the main potential problems, the complications people face with Buerger's?
Well, the big ones we've touched on. Severe limb ischemia, that lack of blood flow.
Leading to gangrene.
Exactly. And potentially amputation. Fingers, toes, feet, even parts of the leg.
That's obviously life-changing.
Hugely. Then there are the recurrent ulcers and infections. They can be really painful, hard to heal, and significantly impact quality of life. And it's vital to remember, continued smoking doesn't just worsen Buerger's. It ramps up the risk of all the other smoking-related diseases too. Heart attacks, strokes.
It's a double whammy.
Triple whammy, really. So aggressive treatment of any ulcer, any infection, any sign of gangrene is absolutely essential.
Okay. So let's wrap this up. Buerger's disease, it's rare, yes, but incredibly serious.
overwhelmingly tied to tobacco use.
Tends to hit younger people, mostly men historically, but we're seeing it in women too.
And it follows a really tough path if smoking doesn't stop. Inflammation, clots, blockages.
Vein ulcers, potentially gangrene, and amputation.
And this is the crucial takeaway there, is hope.
Right. Early diagnosis matters.
And that absolute, complete, permanent stop to all tobacco use. That is the game changer. It can halt the disease progression.
It really underscores the power of that lifestyle change.
Massively.
If you want more detailed information or resources on this, or vascular health generally, do check out pastthemsra.com.
And there's also freemsra.com for more resources.
Okay, great resources there. And maybe a final thought to leave everyone with.
Yeah.
Just how profoundly lifestyle choices, especially regarding tobacco, can impact our vascular health. For conditions like Buerger's, it's not just a risk factor, it's almost everything.
Couldn't agree more. The power to change the course of this disease often lies right there.